updates, we would proceed with the next session for the day, which is a cross-border collaboration in advancing patient access to innovation. The session would be a panel discussion. To lead the discussion, I would like to invite to the stage someone who was already part of the event yesterday. We're happy to have her back. Her name is Dr. Danielle Chalouhi. I hope I said that right. She's the head of market access for Greater Gulf with Sanofi. Please help me welcome Dr. Danielle.
Good afternoon, everyone. This is the most challenging session after lunch, second day. So thanks for your attention and for being in the room. So as mentioned by Katrina, we are going to speak today about the cross-border collaboration in advancing patient access to innovation. For this, I would like to welcome over Zoom Dr. Nermeen Ashoush, who was not able to make it last minute to this event in person. Dr. Nermeen is the Associate Director for Health Economics and Outcomes Research at Amgen, Middle East and Africa. I would like also to welcome Dr. Mohamed Larbi Jelassi, Head of Market Access International at Spimaco, and Dr. Sofyan Migdadi, Head of Pharmaceuticals and Procurement Department at King Abdulla Hospital in Jordan. How are you doing today?
Fine, thank you.
Good. Dr. Nermeen, can you hear us?
Yes.
Yeah, sorry for the delay. We had a few minutes delay. So I'll start the first question with you.
Okay, my pleasure.
How do different countries and regions approach the regulation of innovative healthcare products, and how can these differences be harmonized to ensure patient access worldwide?
First of all, thank you, Dr. Danielle, for your introduction, and thank you for the very important question. As you all know, that in recent decades, the healthcare system around the globe have been transitioning from a utilization-based model that emphasizes volume to a marketplace that is focused on impact on the patient and value. Now, as you know, that across the Middle East, even if we are talking about UAE, now there is a shift to unified pharmaceutical tendering system. And definitely, if we take the cost only as the sole factor for evaluation, definitely that will impact the patient access to innovative medication. So based on your question, I would like to highlight the best practice for evaluating the innovative medication across the developed countries because they faced the same challenges as the rest of the countries across the Middle East. So if we take in consideration or overemphasis on saving signals, a lack of commitment to healthcare innovation, and definitely that will discourage the research investment and clinical trials beside the drug shortage and limited options if we take in consideration only the cost and not taking in consideration the value. So contrary to the concern that centralized procurement might restrict access to novel, unpatented molecules, now the other healthcare system or the developed countries, they have strategically deployed sophisticated solutions or mechanisms such as, for example, HTA and risk-sharing agreements in order to take in consideration the outcome benefit and also take in consideration the price. So if I'm talking about the developed countries, what they have done regarding the managed entry agreement, and the good part that the Middle East countries, they started to apply also the managed entry agreement if I'm talking about Saudi Arabia or UAE. For example, most of the authorities in Italy, they have adopted innovative access agreement within their system, like the outcome-based managed entry agreement, as a mechanism for managing uncertainty around innovative therapies, particularly for the oncology and high-cost specialty medications. The good part is that the UAE, they started to implement outcome-based managed entry agreement Also, Saudi Arabia, in some accounts, it became mandatory in order for innovative medication to be enlisted. They should apply an outcome-based managed entry agreement to manage the uncertainty regarding the outcomes benefit on the patients. If I'm going to take another example, like Germany, they also have applied a more structured approach through conditional reimbursement agreement, allowing temporary market access for innovative drugs while collecting real-world data evidence to confirm their clinical value. Another country like Singapore, they also stands out for its pragmatic risk-sharing framework that blend the financial risk mitigation with a focus on the healthcare system sustainability, often negotiating a performance-based contract that align pharmaceutical pricing with demonstrated patient benefits. So you will find that most of the developed countries, in order to guarantee the outcome benefit on the patient regarding the innovative medication and to manage the uncertainty of the decision makers regarding the outcome benefit, they started to apply different types of managed entry agreement that manage the uncertainty regarding the outcomes. And definitely when you apply the managed entry agreement, it will have a financial savings to the payers.
Great response. Quite comprehensive approach, Dr. Nermeen. Thank you very much. So before moving to the next question, what I can, if I may summarize, it's basically countries could learn from others who are more advanced in the way they approach the challenges of, let's say, innovative medications with what comes in terms of expensive, let's say, annual cost, etc. And there are different methods to apply this. So give yourself a chance, I would say. The countries need to learn from other countries who already tried and tested, and give another opportunity, let's say, to look at the affordability of the treatment through an innovative angle as well. How can global partnerships between governments, healthcare providers, and the private sector be strengthened to ensure innovation reaches the patients who need it most?
Good afternoon. Thank you for the question. First of all, we would like to ensure that we want to ensure and make availability of high technology products available. First of all, we have to look at the regulatory part. So we have to make alignment and compliance with the regulatory requirements and agreed by all parties involved within the requirements of registration, either the regulatory body or the manufacturer or distributor. Then we will go to the part of the pricing, how the prices will go, and ensuring that all prices will be affordable by either the insuring party or by government, and how the distributor or manufacturer or whoever will be able to provide tiered pricing, and also to provide a patient access program in order to ensure the accessibility for this innovative medication for the end users who are the patients. Also, we have to take into consideration that we must invest more and more in the infrastructure of the healthcare service, also to provide training programs, to upgrade the level of knowledge of how to diagnose, how to treat, how to handle these types of medication. Also by providing either scholarships or trainings also for the policymakers, researchers, also providing these types of training for all the people, also training for the patient, the end users, if there's a complication and these types of side effects, or how to handle, how to use these types of medication. Also, we have to take into consideration also that involving of digital health, the telemedicine, the telepharmacy. This will be an important part of training also, and upgrading of the knowledge of all stakeholders involved within healthcare service as a whole. And finally, we have to ensure the last mile delivery of the medication by making agreement with the logistics companies or something like that in order to ensure the delivery to the last mile. Yes, thank you.
Great answer. Thank you. It shows how important it is that the multiple stakeholders involved in the patient journey actually should collaborate in an innovative way. So adopting also what's happening around the world with digitalization, modernization, working together to upskill also the infrastructure so that they can reach to whatever we said, for example, the managed entry agreements part, etc. If you don't have the right setup, you will not be able to perform neither the regulatory stage, nor the pricing stage, nor later on the reimbursement decisions, etc. properly. Thank you so much for this perspective.
Thank you.
Dr. Mohamed, question on international collaborations. So how can international collaborations help address disparities in healthcare access, especially for underprivileged or underserved populations in lower income countries?
Thank you, Danielle, for the question and for having me in this panel. And thank you all who are in this room after the lunch. I think that the most difficult role is to survive and to be focused on the discussion after lunch. So we are all grateful for you. All on the stage are grateful for the people who are still attending and focusing on the discussion. I think that first of all, we need to agree on what healthcare access is, because it could be an 0 or 1 access to a drug. But it also having access to a drug that have proven quality, efficacy, and safety. That means that all will start with harmonization of regulation. And with all the initiative or harmonization that we are seeing all across the world now, African agency, joint submission here, centralized submission here in Gulf, probably recently the WAD Arab agency. I think that one of the initiatives was the European joint assessment that led not only to streamline and accelerate access to medicine, but also to increase the capabilities of different authorities learning from each other. You remember, Michel, you were in France also a couple of years ago, and you remember that the secretariat and the coordination of assessment depended a lot on the ability and capability of each country for a certain therapeutic area or certain technology. And at the end of the day, after 10 years, probably Italy learned a lot from Ireland when it comes to biotechnology, France learned from Germany and vice versa. So joint assessment, it's not only about making sure that there is less time to assess a product, but also to increase the capability and the skills within national regulatory body, and it benefited a lot to national regulatory body. So I really hope that at Arab level, at Middle East level, at African level, it will not just shortcutting national agency assessment, but also increasing, especially clinical assessment capabilities within regulatory body at national level. And when we can secure this, let's say, raising the bar when it comes to standards, technical standards, we can also move to joint and pool procurement. And of course, beware, there is a pitfall. Joint procurement could be easily a hurdle to access, by the way. By reducing the bar, by saying that we will just align on the bare minimum, and whatever is beyond that, it's up to every country to do it, or up to private insurers to do it, or whatever. Joint procurement could be a way to leverage on the negotiation capabilities of big markets, of well-regulated markets, of trained regulator or trained procurement bodies on negotiation, to also grant the same level access and the same high level of access to smaller markets, to markets that are probably new to negotiation or that are probably overlooked by some companies. And at the end of the day, joint procurement is not only about procurement, because 100%, or let's say 90% of the situation, it will lead also to more or less full reimbursement, formulary listing. So it starts there, but it fosters patient access. Also, and in this on this topic, pandemic was, in brackets, a trigger or a spark for that. Public-private partnership were probably very known when it comes to build hospitals, to build clinics, to do some big R&D projects. But access to COVID vaccine, which was mandatory for the global economy, so we cannot afford to have a country vaccinated another country who is not, triggered a lot of public-private partnerships like Gavi one, and I had on a personal level to deal with that in my home country in Tunisia. And I can say that financially wise, it helps accelerate access. It helps having fair access and the same access across the globe. My country didn't have a lot of capability financial wise or negotiation wise. We were even overwhelmed by providing the country with masks and alcohol gel. So we're really happy to have this support. But at the same time, again, watch out. Public-private partnership should, at the end of the day, not serving the NGO, let's say, aims or the private only. It should, at the end of the day, benefit to the country, to the government, and to the patient access. This is something that we need to align in before to implement something that is a win-win situation for everybody. Last but not least, probably the most important one or the most known one is tech transfer. And allow me also to extend it beyond to what I can call knowledge transfer. Tech transfer could be as straightforward as transferring biological product, biosimilar product, industrial know-how from a country to another to reduce either the lead time or the cost. Knowing that transferring technology, at least at the beginning, will probably increase the industrial costs, but at least it will increase other capabilities within the country and the market and reduce the lead time and increase the supply chain resilience. But it also takes, to make some knowledge transfer, we've all, I think, came through this managed entry agreement. They might be very easy and quite straightforward when it comes to financial agreements or even to volume or financial caps. But when it comes to what I consider as, let's say, the cutting edge of a managed entry agreement, so paying fair performance, monitoring performance, it takes technology, it takes to have monitoring of patient, it takes to have e-tools to do it, and a lot of countries might benefit from this cross-border collaboration to implement them.
Thank you very much. Also very rounded question, answer with concrete examples. Like, I think we are not that far from COVID, although it might appear like it's several years ago, but actually it was less than 5 years ago. And there are a lot
So we
of
still have time till the next pandemic.
Yeah, I hope so. But at least, yeah, we need to deploy and think already about what could be potential solutions so that we can immediately implement, from what we have learned and thought about post-pandemic. Question to you, Dr. Sofyan. So from your perspective as a provider, how can pharmaceutical and biotech companies engage in cross-border collaboration to overcome logistical challenges, especially with respect to the supply chain and access to medicine in remote areas, from your perspective as, managing?
Just first of all, we have to take into consideration that for implementation of pharmaceutical regional hub, it will be one of the more steps that could overcome such challenges. We can maintain the availabilities and we can minimize the lead times a lot. So we can avoid shortages, stock out, so that we can ensuring the availability and at the same time the accessibility of the right medication in the right time. This first point. Second point, formation of joint supply chain management activities as a whole in different varieties regarding starting from drug selection, quantification, and procurement, and of course inventory management and distribution, where we take these as a joint activities in different cross-border countries. This will simplify the work and it will become much more fruitful. And the results will be increasing the accessibility of this medication. Also, make a joint procurement activities also will simplify these processes a lot. In addition to that, we have to take into consideration that through implementation of public-private partnership, this could help a lot in increasing the accessibility by providing mobile health clinics that could provide the healthcare service in remote areas. Also, we can providing this by making training and for the training programs and capacity building programs for the healthcare providers in different areas. By providing also tiered pricing for the medication from the wholesaler or the manufacturer. This will increase also the accessibility and the availability and of course the accessibility of these high technology products for the patient in the last mile. And also we have that we can, by technology transfer from the patent manufacturer to local manufacturers by under licensing of specific types of products and capacity building of local manufacturer. This will increase the accessibility of these high technology products and increase the accessibility for these patients.
Thank you. A lot of food for thoughts, actually, of the ways to improve the collaboration and how we ensure really that no patient is left behind regardless of their geography, complementing what Dr. Mohamed was talking about. Dr. Nermeen? Last question from my end, but then I'll open it to the audience. So please start thinking of any questions you might have for the audience. Dr. Nermeen, from your experience in the Middle East and Africa region, what are the main criteria considered in procurement of pharmaceutical supplies in the region? And what are potential improvement opportunities for patient access to innovation?
Okay. Thank you for your question, Danielle. Concerning the main criteria, as you know, for the national procurement system, we need to enable access to safe, effective drugs and ensure efficient operations. But as you all know, that definitely the main criteria across the Middle East is the cost-only approach. And as you all know that we are trying to find other solutions to improve access to innovation, and actually the countries, they started to take in consideration not only the price as a sole factor, because the decision makers, they now understand that if they are going for the medication of a low price, definitely they are going to waste their budget or their financial resources. So let me give you some examples randomly across the Middle East. If I'm going to talk about first Saudi Arabia, now in most of the accounts, it became mandatory that the pharmaceutical companies should submit economic evaluation to prove that their innovative medication, it provides a good value for money, it will provide the maximum benefits to the patient within the financial resources in each account. They started also to ask for the submission of economic evaluation from the early beginning for the registration and the registration renewal. But let me share with you something, Dr. Danielle and the rest of the audience, is that now we started to have an open discussion with the regulators that starting to use or to submit economic evaluation from the early beginning of the registration process, it might cause delay for the access to innovative medication. Because sometimes you will have drawbacks for the application of not the right guidelines, for example, for HTA, because in the guidelines, they started to mention that they will evaluate based on a fixed ICER threshold, not the WHO guidelines, which is the 3 times GDP per capita. They are going to take a fixed threshold, which is a 1 time GDP per capita. And definitely, if we took that in consideration from the early beginning, from the registration process, it might cause delay for the access to innovation. So we need to have like an open discussion. And actually, we started to do that through the Pharma Association, to have an open discussion with the policymakers and the regulator. So they started to take in consideration HTA. As I told you, they took in consideration also the managed entry agreement. But most of the Middle East countries, they are taking in consideration only one type of managed entry agreement, which is the outcomes-based managed entry agreement. And definitely we are facing some challenges in the execution of the outcome-based managed entry agreement across the Middle East countries. So we need to start thinking about the rest of the managed entry agreement by having an open dialogue with the regulators and the policymakers to raise the awareness that we have other types of managed entry agreement, like the financial-based managed entry agreement, that we can apply in addition to the outcome-based managed entry agreement. Also, as I discussed yesterday, we need to take in consideration other multiple criteria for evaluating the innovative medication. For example, we take in consideration the services that are provided by the company, value-added services, economic evaluation, but we have to take in consideration the supply reliability of the company and other criteria when we are evaluating any innovative medication. Also, single winner approach, it will have some vulnerabilities and challenges for the continuous supply of the innovative medication. And if you are going to check globally, they shifted from a single winner to multiple winner when we are talking about a unified national procurement. So we have a lot of solutions that we need to have an open discussion between the pharma companies in a policy forum with the regulators to find solutions and to overcome the challenges that we are facing every now and then and might impact access to innovative medication. Let me share with you another example. If I'm talking about Algeria now, they started to take in consideration the economic evaluation to be submitted to the Ministry of Pharmaceutical Industry when they are going to register any product other than oncology or hematology product, which is very good for the accessibility to innovative medication. Morocco also, they are on the path for the application of universal healthcare coverage and HTA. So we need to share the best practice sharing and the lessons learned across the Middle East countries and how we can tailor our own guidelines based on our healthcare system and healthcare financing so that we can improve and sustain access to innovative medication. If we are going also to consider the local content, it's one of the requirements nowadays, the localization part, and one of the criteria that are considered. And definitely we cannot put it as a sole factor for the evaluation of the innovative medication. We have to consider other criteria for evaluating and improving the access to the innovative medication. So now the Middle East countries, they started to apply HTA, they started to apply managed entry agreement, but still we need to have a room for discussion to sustain the access to the innovative medication and not only take the cost as the sole factor for evaluating the innovative product. Also, regarding the rare disease and orphan medications, they started to apply the multi-criteria decision analysis and not to focus on the economic evaluation in Saudi Arabia. So if we have a policy forum for the Middle East countries to have a roundtable discussion, to share the experience from one country to another, I think this will help us to sustain the access to innovative medication and find solutions for any challenges that we are facing nowadays.
Thank you so much, Dr. Nermeen. Also lots of good ideas, things that have already taken place, and what are the first key learnings, I would say, from this experience in the implementation in the region. And I mean, I hear you calling for more open dialogue and collaboration, you know, with the sole objective of how we can improve patient access and outcomes in general. So thanks a lot, Dr. Nermeen. I actually have one more and last question to you, Dr. Mohamed. How do you see the future of telemedicine, digital tools, and AI in helping cross-border collaboration, enhance patient access to care, particularly in remote and underserved areas?
Before speaking about the future of e-health, let me share with you what was the past of health through a very dramatic example. Probably back to more than 20 years ago, WHO tried to conduct a pilot experience in a South African village where AIDS prevalence was skyrocketing, and they tried to experience circumcision for the whole village, regardless of their ethnic or religious background, aiming to reduce the transmission. It was a project of $20 million at the time to have all the technical facility and capability in the closest urban area to this village. Couple of months after that, they tried to monitor, and probably only 5 or 10% of the eligible population made it to this intervention. They tried to dig and to understand what's going on. And to make this very long and sad story short, people in this village were unable to pay for as low as $1 to move from their village to the nearest urban area and to get access to a $20 million project. So in that perspective, you can understand how much now technology, AI tools, could have enhanced and sorted out this last mile or probably first mile delivery of this healthcare service, and also early monitoring and understanding of those pitfalls and bottlenecks in the process. So I'm completely happy and really feel very comfortable living on this area of e-health because everything became possible. First of all, telemedicine. And again, when I was in pharmacy college, telemedicine was, thrown here and there by our professor like science fiction. And now we are in an era where Médecins Sans Frontières, so Physicians Without Borders, which is an NGO, is able to connect physicians in crisis conflict zones to other physician colleagues in peaceful zones so they can communicate and follow up their patient together. But it's also an area where Sahha, completely virtual hospital in Saudi Arabia, is now leveraged on to increase access to health and to reduce the economic burden of healthcare. So it could span crisis and business as usual when it comes to health. Also, AI-powered diagnosis. So it could be probably as sophisticated as the AI diagnosis tool of Google, or as simple as a simple trained image processing tool that can identify retinopathy early when it comes to diabetes management. Also, data exchange. with those universal health coverage and cross-border health coverage, countries like Estonia, but also probably the best case to follow is the European case again, when you can carry your e-medical dossier from European country to another, and still your healthcare provider will access your e-dossier, can renew your treatment, can know your condition, treat you, be it an emergency or a chronic disease follow-up or an acute disease follow-up. So that might be simple, but that was possible through data management and through technology. Something that was, I think, a couple of years ago, before the trend of AI, is Internet of Things. So, of course, for us now, Internet of Things is this non-watch called Apple Watch or Samsung Watch or whatever. But when you see that Apollo project in India allows the government to follow up to millions of heart failure patients remotely using wearable, you can understand that our daily gadgets are probably saving lives in this country/continent, and this could be expanded to more countries and to more people, hopefully. So whatever the technology is, whatever our understanding of the technology is, I think that future will be powered by technology. And just to loop on our main topic, which is tendering and supply chain, we are all more or less familiar with cryptocurrency, but probably it's currently used, or blockchain is used to secure and to make safe complex supply chain of drugs. Probably Tatmin is using that. I don't know, honestly. I'll have to check. I should have checked before. But I wouldn't be surprised that Tatmin is using somehow blockchain technology to secure supply of drugs. So I hope we'll embrace technology. Probably it will not 100% replace us, but we will be replaced by people who master technology better than us, for sure. So let's embark in it to make sure that we'll be here in 10 years also.
Well, I hope we will make use of the technology before it makes use of us.
My excuses to Sarah Connor, by the way.
Thank you very much for your attention. Thank you.
Thank you, Danielle. Thank you, Nermeen, by the way.
Thank you so much.
Thank you so much for this insightful discussion.